Good afternoon, Winnebago tribal members and community. Welcome to the April COVID live stream update. Thank you for joining us. Thank you for practicing social distancing, wearing masks, and doing all the things you need to protect yourself and your family. Stay tuned for exciting updates and questions responsive to tribal members' concerns. So, thanks.
Thank you, Tori. And we will now head over to Danelle for an update from WCHS. Danelle?
Thank you, Tori. Thank you, Emily. Good evening, everyone. Thank you all for joining us for this edition of our what is now monthly community update. I would like to start out by reminding everyone that we continue to have COVID-19 vaccinations available to anyone who wants to be vaccinated. Mona has some more details about the vaccination clinics, but just to get started with, the Winnebago Public Health Department continues to offer the Pfizer vaccine on a weekly basis, and the hospital now also has the Janssen vaccine available, which is also known as Johnson & Johnson, which is the one-shot vaccine. And our first clinic for the Johnson & Johnson Janssen vaccine is Friday, April 16th. So like I said, Mona has more details about that at the conclusion of our report from the health department and the hospital, but I just really want to emphasize the importance of having our community fully vaccinated, and the fact that we have these resources available is really tremendous. And so I just want to encourage everybody, if you are not vaccinated, I encourage you to get your questions answered and sign up for one of our vaccination clinics in order to protect yourself, but also to protect those around you. During today's presentation, Mona will also share the most recent data regarding our COVID-19 positive cases in Winnebago and the current status of our vaccination rates in Winnebago. Before we move into that, I would also like to provide a brief update on the status of the CMS certification for 12 Clans Unity Hospital. We previously shared that the hospital had submitted an application to CMS for certification back in January of 2021. As part of this process, the CMS sends a survey team on an unannounced basis to the hospital to review our hospital operations and confirm that we meet or exceed all of the certification standards. As expected, CMS did send an unannounced survey team, which means we did not know exactly when they were going to be coming during the week of March 22nd. So we were very excited to receive the survey team. And the team of surveyors spent 3 days at the hospital reviewing documents, interviewing staff, and reviewing select patient records. As a part of this process, in addition to the document review, staff review, and record review, CMS requirements also dictate that they observe direct inpatient care. At the time when they arrived, we did not have any inpatients in-house. So this means that CMS is going to have to come back again at a later date in order to fully complete the remainder of the survey. So we received very positive feedback from the survey team while they were here, and we will remain in communication with the CMS leadership regarding this ongoing process for our hospital. So I just wanted to share this progress update with you, and also say that I'm very proud of our entire hospital staff for all of the great work that they have been doing, all of the great leadership and cooperation and teamwork that they displayed during the survey process during March, and but also the fact that our team, of course, maintains those high standards on a daily basis. So very exciting, and I just wanted to provide an update for all of you as we move toward our path to CMS certification. I will now turn it over to Mona for her remarks for today and to share our COVID-19 update. Mona?
All right, thank you, Danelle. Good evening, Winnebago community. There's been a lot going on with the weekly COVID-19 vaccine clinics. So I also encourage everyone to stand with us and sign up. We do aim to vaccinate each week 300 people, which is a combination of first doses and boosters, but we have been falling short of that number. So we do encourage everyone to reach out and get signed up. And there's several ways to sign up on the website. And so we can go over that a little bit more in the presentation. But our priorities continue to remain the following: community members, tribal members in the surrounding areas, tribal businesses and employees, and then everyone else. But it is vital for people to keep their appointments. As more of our community is vaccinated, it does become harder to fill with new people. Also, as many of you might know, it is Public Health Awareness Week. So it's time to reflect on all of the prevention, intervention, and activities that public health has performed over the past year, and all of the activities that highlight the mission to reduce health disparities within our community. It is not too late to sign up for the virtual walk on Friday to get your t-shirt and some physical activity in tomorrow. The mobile clinic will also be at Land of Wellness to walk through and be able to get your blood pressure or your glucose checked by one of our staff. You might have also been able to see on our Facebook page, I wanted to congratulate the Winnebago Public Health Nursing Department on receiving the Great Plains Awards Area Directors Award for Outstanding COVID-19 Activities. The nomination outlined that in an unprecedented time, our public health nursing team from day one has dedicated countless hours in prevention and control of COVID-19 in the Winnebago community through operating the hotline, providing home COVID testing, providing community education for prevention and infection control, and quarantine and isolation recommendations and daily monitoring of our patients. I also wanted to congratulate the Winnebago Medical Services Department on receiving the Great Plains Area's Engagement Champion Award. The nomination outlined that the medical services program are the unsung heroes every day. But during COVID-19, their services were called upon at an unprecedented amount. When everyone else was working from home, this staff was at work, ready to help the community in whatever way was required. They delivered medications, COVID care packages, checked on COVID patients, transported COVID patients to wherever was needed, and they did all of this with great sacrifice to themselves and their own families. When people were told to stay at home, it was our medical services division that continued to meet the daily medical needs of our people. These unsung heroes woke up in the middle of the night from their homes to go into the unknown every day. These are our frontline workers that keep our community members safe in their homes and go where others do not. And they continue to work at great jeopardy to themselves and their families. So I appreciate both of them, as well as all of our public health staff and our hospital staff for all of their continued service. So please continue to keep an eye on the Winnebago Public Health Department Facebook page. We have all of our activities on there and we'll continue to provide updates. And so now I will start this week's presentation. So currently in Winnebago, we have 0 positive cases, 0 active cases. Our total positives have been 348, with 343 have recovered. We have 1 household in quarantine, 5 that have died from COVID-19 related. We have administered 1,964 first doses, 1,508 total boosters, or the total for their second dose, and which is 3,472 vaccinations. So the breakdown of total COVID-19 cases in Winnebago, we have had 26% were 0 to 19, 27% were 20 to 29 years of age, and then our 30 to 39 years old was about 16%. And then not quite half and half, we had 54% that were female and 46% that were male. So since January 3rd, when we started our COVID vaccines within the community, we have now seen that 0 to 19 have made up 29% of our cases, followed by 20 to 29 years old, were 24%, and then our 40 to 49-year-olds were 14%. And the makeup was a little bit, 57% were female and 43% were male. So this just indicates from April of 2020 to present that we have had 190 cases that have been linked to an initial isolated case. So this slide shows us all the exposure areas that we've had since April 20 of 2020. Okay, positives within the household or close contacts have been 190, followed by 87 from social gatherings, 47 from family gatherings, and then a few others, as you can see. Since January 3rd, when we started our vaccine clinics, we can see that 20 of them have been from positives within the household or close contacts, 16 from social gatherings, 5 from family gatherings, and then 1 from incarceration. This is just a trend over time. So April 2020 to present. And so you see all of the peaks and valleys, and obviously with our most cases being back in December, and then has drastically reduced since then. So this slide indicates the non-vaccinated versus vaccinated. We had 2 that were fully vaccinated, positives, 2 that were positive after their initial shot, and then 40 that were not vaccinated. So I know we wanted to see some of the vaccination data as well. So January 3rd to present, not this week's, but last week's data. We're still compiling yesterday's, but you can see that for the 19 to 29-year-old, there's about 20% that have been vaccinated. And then roughly 40 to 49 and 30 to 39 are all 16%. And then 50 to 59 years old is 18%. And then approximately 57% were female and 43% were male. So for the unvaccinated persons in Winnebago, we have about 37% of our 19 to 29-year-olds are still unvaccinated, followed by 30 to 39-year-olds, which is about 18%, and then our 40 to 49-year-olds, which is 17%. And it's roughly about half and half, with our males being 51% and our females being 49%. So we are offering 2 vaccination clinics, one through the Winnebago Public Health Department, which is offering the Pfizer vaccine on Wednesdays at the Winnebago Public School. Appointments are open to anyone 16 years and older. To schedule an appointment, you can submit to that form there or call 402-878-2258. Or if you would prefer to do the Johnson & Johnson or Janssen vaccine, you can, the 12 Clans Unity Hospital will be doing a separate vaccine clinic for that, which the first one will be held on Friday, April 16th, located at the 12 Clans Unity Hospital. And the Janssen clinic is open to anyone 18 years old and older. Please make an appointment by submitting the form that you see on there. And remember, you cannot mix. So once you started with Pfizer, you need to complete Pfizer, or if you started Moderna somewhere else, you need to continue Moderna somewhere else. And just some information about the COVID-19 variants. So just a reminder that viruses constantly change through mutation. The new variants of COVID-19 are expected to happen over time. Multiple variants of the viruses that cause COVID-19 have been found in the United States. So the B.1.1.7 variant was first identified in the United Kingdom and later found in the United States in December of 2020. The B.1.1.7 is the variant that was found in Winnebago. These variants seem to spread more easily and quickly through other variants, which may lead to more cases of COVID-19. So far, studies have shown that COVID-19 vaccines work against the variants.
All right, thank you very much, Mona. That concludes our data for today's COVID presentation. Two quick notes. I want to remind everybody that we do have a Snapchat filter and Facebook frame that are available through our COVID vaccine clinics. So anybody that goes to our COVID vaccine clinics here at the hospital or at the public school can check out Snapchat for the filter and post photos. We encourage you to share them on social media using the hashtag Winnebago Strong and use our frame as well when you get your vaccine to show you got vaccinated. So we will now move on to an update from the Winnebago Public Schools with Dan Farringer. Dan?
Good afternoon, everyone. Again, the vaccination clinic is being held in the practice gym on Wednesdays and is going well. We'll continue to support the vaccination needs until the vaccination needs of the community are met. Spring activities are underway. The football team just left this afternoon for Cheyenne Eagle Butte. They'll have their game tomorrow. Information on the Alert Now and WPS Facebook page will give the details of what's going on. Track will have their first competition tomorrow, and golf's first competition will be soon. Prom is scheduled for next Saturday, April 17th at WPS. Again, thank you, Mona, for going through our plan and approving that. We will practice health safety measures during that time, although the kids will get to have their masks down during pictures and all that fun stuff. The spring musical, Singing in the Rain, keep practicing. The performances will be in May. More information will come out later as that gets closer. Summer school information will be coming out soon. We'll be having some sessions for both the elementary and the high school starting in June and going into July. Again, protocol is being followed and no staff members are in the building if they test positive until the notice says they can return. Same thing with students. We continue to keep the building and classrooms disinfected. We wear masks, use desk shields and hand sanitizer, and we social distance when possible. Again, let's just stay safe and continue to work so we can come back to as normal as possible, hopefully by next fall. Thank you.
Thank you, Dan. Next, we'll head over to the president of Little Priest Tribal College for an update. Manoj?
Thank you, Emily. Good afternoon, everybody. Here is a quick update from Little Priest Tribal College. We are providing a $250 incentive for students enrolled in spring semester for getting COVID-19 vaccine. This is our way of promoting strict vaccinations, and we are very proud to see that many of our students are submitting their incentive application to get the $250. At Little Priest Tribal College, 75% of the employees have been vaccinated, and we are hoping that number increases soon. We are updating the COVID-19 cases at the college on our website and the new electronic signage on Highway 77. Summer 2021 registration is open, and this is, I would like to have everybody's attention on this one. Again, just like last year, we are offering 2 free classes for all students. And if you're a Title IV eligible student, you'll also get free textbooks. And if you're a new student, you also get a free laptop, again, if you're a Title IV student. So it's a great opportunity from the funding we have received from the COVID-19 funding. So please make sure you talk to your friends, family members to take advantage of this great offer we are providing. Little Place Tribal College is undergoing a strategic planning for 2021 to 2026. All the feedback has been received and completed. So we are in the final stretch of completing our strategic planning. We expect the planning to be completely done by June 2021. We want you guys to visit our website, littleplace.edu, or our Facebook page to learn more about college news and events, as more updates will be shared there. Again, we want to extend our condolences to anybody in mourning, and we want to encourage everybody to get vaccinated till that wear mass social distance, keep up the good work we have been doing so far. Thank you so much for your time.
Thank you, Manoj. Next, we'll go to HCI for an update with Sam. Sam?
Thank you, Emily, and good evening, Winnebago community. I have two brief items to share today. The first one is on Ho-Chunk Farms. The Agricultural Division of Ho-Chunk Inc. recently made a record farmland lease payout to Winnebago tribal members and the tribe, totaling $1.4 million. Ho-Chunk Farms started in 2012 to increase ag land values and now manages more than 6,000 acres of reservation farmland. If you'd like to learn more on their progress, you can read the full story on the Ho-Chunk Inc. Facebook page. Also, in the idea of spring, the Ho-Chunk Village Farmers Market season is approaching. This year, it will be Saturdays, and the first market date is Saturday, April 17th at 10 a.m. And one of the biggest changes this year will be the addition of a garage sale aspect to the market, which will allow vendors interested in selling their wares to reserve a space in the market. So if you'd like to learn more about the upcoming Village Market season, you can visit the Facebook page for the Ho-Chunk Village Farmers Market, or you can contact the market coordinator, that is Vince Bass, and you can contact Vince at HCCDC. So those are my two updates for this evening. Thank you, everyone.
Thanks, Sam. And lastly, we will go to Winnebago with an update from Mayan Belchin. Mayan?
Good evening, Winnebago community. From Winnebago, we wanted to say a happy 29th anniversary to Winnebago Casino Resort, owned and operated by the Winnebago Tribe of Nebraska. Over the 29 years, we've seen great expansion. We've seen millions and millions of dollars go through to the organizations, to the tribe, to nonprofits. So again, congratulations to the Winnebago Tribe and Winnebago Casino Resort on 29 years. So some of the updates going on, we have about 1/3 of our team members have been vaccinated. We're still currently working on opportunities to do vaccinations at the casino for team members. And we've opened it up as well for family members of our team members out there. We encourage them to get vaccinated. We're also looking at the future. We're looking at possible events. Our first event is scheduled for June, July, each month after that, as far as concerts. As long as the COVID vaccinations, as long as the data from the western northwest corner of Iowa continues in the right direction, we will continue on that path forward to opening up more events through Winnebago Casino Resort. We're also, at the beginning of this month, we opened up a few more amenities of our casino. We opened up our pool, our fitness center, our golf simulator. Currently, we still have some restrictions with no smoking, no individuals 18 or under allowed on property. Again, as safety is our first and highest priority for our team members, our guests, and our community, we're still monitoring those numbers consistently to see when we're going to be able to offer more amenities. We did just try a variation of an all-you-can-eat buffet style over Easter. If you came and enjoyed that, it went very well. So we're looking at doing that a little bit more often and offering more options in the food and beverage area. So again, thank you for listening. We do also encourage social distancing, washing your hands, staying safe, keep your elders and your children safe. Thank you very much from Winnebago Casino Resort.
Thank you, Mayan. And so lastly, we will go ahead and go to the Q&A portion of our community update. So as a reminder, you can submit any questions you have regarding COVID to covid@winnebagotribe.com, or you could submit them on the Facebook page as well, and we will do our best to answer them in our next update, which will be next month. So we'll go ahead with our first question that was submitted. The question is, how many COVID variant cases are in Northeast Nebraska area? Was there contact tracing on how it got here in Winnebago? Mona, can you answer that one?
Yes. So I don't particularly know Northwest area, but I know the variant B117, which is the UK variant, or identified as that, has had 51 cases in Nebraska. The variant B135.1 is the variant commonly known as the South African one, which was also found in December of 2020. There are currently 0 cases of that variant in Nebraska. And then the variant P1, which is commonly known as the Brazilian variant, back in January of 2021, found in the US. There are 2 cases identified in Nebraska. There are actually 2 other variants first found in California in February of 2021, as well as March 2021, which is the B1427 and B1429, and neither of those have been identified in Nebraska at this time. We did do contact tracing, of course, on all of our positive cases, and so the variants were traced back to close contacts.
Okay, thank you for that information, Mona. The next question is, we are a few months away until Powwow. Will we have it? A suggestion would be to show the vaccine card in order to participate. Chairwoman, can you answer that question?
Yes, thank you for the question. The Tribal Council had email discussion about Powwow, and at the March 15th mid-monthly meeting, the Tribal Council advertised for a Powwow Committee, understanding that we were at that time several months away, that it would have to be a quick turnaround. So we advertised for 2 weeks, and we had received a couple applications. Those applications haven't come before the council yet, and we're hoping that we'll get some more applications to put some contingent plans in place. As the tribal members know, we were not able to have the last ceremony celebration. The committee had put together some hybrid plans, and in the end, with the onset of the variant case we had, there was some hesitancy, to proceed. So we really thank the committee, the last ceremony committee, for their work on identifying caution. And whatever happens with Winnebago Powwow, the leadership will be proceeding with that same caution, also under the advisement of the Public Health Department, to have the safest celebration. So it's yet to be determined. The council is looking to seat a committee, and we look forward to working with the veterans to make this the best celebration and honor the veterans as we always have. So stay tuned.
Okay, great. Thank you so much for that answer. The next question is, I'm going to direct this towards Mona again. Is the variant the dominant source of COVID, and what is the plan for the new wave?
So as of today, we've only had 2 cases detected of the UK variant, but the 12 Cleanse Unity Hospital's lab will be sending all of our Winnebago positives to be analyzed on whether it is the variant strand. But we do need to continue to take all of the precautions, and really our best plan is to be vaccinated.
Okay, great, thank you. Next question is, when will the American Rescue Plan funding come? Will the hospital take public comment on how to best spend the funding? Danelle, can you answer that one?
Sure. We do not yet have a time frame for the funding from the new congressional funding that's been authorized. The funding agencies are in the process of doing consultations with tribes throughout the country to get input on that funding, and so we do not have a set time frame on when or exactly how much the tribe will be getting or how much the WCHS will be getting through the healthcare component. So we're keeping an eye on that and just monitoring it. And as far as public comment, I mean, we're always open to suggestions and input from the community on ideas and input on how we can best utilize those resources and make sure that we have everything in place that we need to take good care of our patients and keep our community safe and protected. So we're open to input always.
Great, thank you. And to add to that too, both of our websites for the hospital and health department have a comment form on the top tab of both websites, and anybody can go in there and submit a comment form or contact if they wish as well. So feel free to visit 12clanshospital.com or the Winnebago publichealth.com. So next question. And Mona, I know you touched on this already, but maybe you can expand upon it, is how many tribal members have been vaccinated? There are a lot of non-Native people going to the clinics, as everybody here, and I know we've announced our clinics are open to everybody. I hope we are setting aside our vaccines for the tribal members first. So Mona, do you want to expand upon that?
I do not, at this moment, have the amount of tribal members that have been vaccinated. I do have that we have vaccinated, at least with one dose, 892 identified Winnebago community members. Our priorities are still the same. We do the priorities as I described earlier: the Winnebago community members, tribal businesses, and then everyone else. We do need all the Winnebago community members that would like to get vaccinated to sign up so we can get them in immediately, which is our best defense, as we can see by the reduction of the positive cases within our community.
Okay, great, thank you. Next question is about Winnebago, so I'm going to direct it towards Maya, and I know you touched on this already in your update, but it said, Winnebago doesn't offer a lot of services like no kids on the property with the pool closing, no smoking, and the buffet. They're worried about the players going to different casinos. Is there any time frame about when everything will be opened back up, or what you guys are looking at?
So yeah, again, we constantly are monitoring what's going on, not only in Winnebago community, but in the northwest corner of Iowa. The data shows that recently there's been a little bit more of a spike in positive cases again, and the CDC and Dr. Fauci is also mentioning a fourth wave. So, you know, as we monitor that data, again, safety is first at Winnebago. You know, it's a casino hotel. It's not really meant for kids at this time anyway. There's not a lot for kids to do. I know that some people bring their kids when they travel or something, but you know, we've been the same way since we reopened after the pandemic in June of last year. So that hasn't changed. And a lot of casinos haven't changed that format. You know, things are closed down through attrition, through business levels. And we're doing our best to try to stay on top of that. As we said at the beginning of April, we have started opening up other amenities for our guests, which are the pool, the golf simulator, and the fitness rooms. And we still are monitoring when we can do you know, the smoking, the younger than 18 in the facility, and opening up more amenities. But as we monitor the data, we haven't made that decision yet. What I will say is we also started allowing some smaller events. We're doing a wedding, we're doing some birthday parties and get-togethers in our hotel convention centers. But we're definitely taking precautions in those. As we're still doing, you still have to get your temperature checked when you come in. You got to wear your mask. we're advising. We have hand sanitizers and wipes, hand sanitizing wipes throughout the casino. So again, wash your hands, safe distancing, and wear your mask while you're at the casino. We are doing our best to monitor and offer those amenities, but we just haven't done everything yet.
Okay, great. Thank you for the update, Mayan. Next question. Mona, you mentioned that it could be a possibility for us to be done with the pandemic in the summer, and I think that was probably a while ago. They wanted to know if you still thought that was a good timeline, or what your timeline were thinking, or if it's changed at all. So what are your thoughts on that?
I think, I'm not sure when that was, so I'd have to look for sure. But I think with the vaccine being rolled out, I guess when I maybe made that statement, I didn't realize that there was going to be so much vaccine hesitancy, knowing that how many people were looking forward to a vaccine. So I was hoping that we would have already been at our 80% within the community. But right now we're only at 68% of our community members vaccinated. So I guess if you're asking if you're still going to have to wear a mask this summer, it's probably going to be. But the CDC has already recommended that the fully vaccinated people, can visit inside a home or a private setting without a mask with other fully vaccinated people of age, visit inside a home or a private setting without a mask with one household of unvaccinated people who are not at risk for severe illnesses, traveling domestically without a pre or post travel test or without quarantining after travel. They have also said with travel internationally without a pre-travel test, depending on the destination, or without quarantining after travel. So we're moving in the right direction, but we still have to continue our precautions as we see fit, but we're sure hoping that everyone will be vaccinated by this summer.
Great. Thank you again for your answer. The next question is for Chairwoman Kitjian. The Tribal Council, does the Tribal Council have any idea when they will go back to in-person Tribal Council meetings?
Thanks for the question. Right now, the Tribal Council has a standing resolution to meet virtually. The tribe did invest in the GoToWebinar software so that there would be increased access for tribal members. Also, but we do understand that some elders and those that don't have internet connectivity aren't able to still participate. So as the pandemic evolves, as we develop herd immunity, I think coming back to face-to-face meetings and large gatherings will be more of a reality. So I just want to also put a plug in for vaccination and it being the only tools that we have now to fight this virus. And I understand the hesitancy, and it's certainly a personal choice. But as we kind of work towards all these things like powwow, in-person meetings, bringing folks back to work full-time in the office, these are all the factors and variables that we need to measure and weigh when we decide to come back in full force. So we are mindful of that. We also miss in-person discussions. I'll remind the council that the tribal members are just as eager to get back to face-to-face.
Great, thank you, Chairwoman. The last question is for, I'm going to direct it towards Danelle. Will there be any incentives for those who are vaccinated? Little Priest is doing a $250 giveaway for the students, and they were wondering if WCHS or the tribe should do it.
At this point, the biggest incentive for getting vaccinated is the protection against getting COVID-19 for both you and your family. So to me, that is a huge incentive and should really, should be encouragement enough. And I understand that some of these other things, might be persuasive for people. At this time, the Pandemic Task Force, neither the Pandemic Task Force or WCHS has discussed providing other additional incentives. But, things change and we evolve and we learn more. So I can't say that will never happen, but at this point, we're not looking at doing that. And as for the tribe, I'm not aware that the council has talked about that at all. And if they have, Tori would know about that, but I don't think that's on the table currently.
Okay, thank you so much. So that concludes today's Q&A questions. If you have any questions you would like to submit for our next community update, which will be on Thursday, May 13th. So the second Thursday of every month will be our community updates. Submit those to covid@winnebagotribe.com, or you can message any of the tribe or hospital or health department Facebook pages, and we will answer those as well. So that concludes today. Sign up for your COVID vaccines by calling the PHN phone number at 2258, or you can sign up for the Janssen by calling the hospital at 2231. Thank you all for your participation, and we will see you all next month.
Thank you.
Thank you.
Thank
you.
you.